Greetings to all my viewers. Welcome to another edition of Learning Disabilities. Today's topic, we're going to focus on transitioning. When a child gets to the age of 18 and they start receiving help and support from the adult services, this process is called transitioning. Every child who has a diagnosis of a learning disabilities have the right to have their needs met. What is transitioning? In the healthcare sectors, transitioning is described as a process whereby a long planning, working with the young person, moving them from children's services to an adult services. This is a gradual process of changes that allows more time for the young person and their families to prepare them when the change happens. That is when the child is transitioning from the children's services to the adult services. It can be very healthy. It can be very emotional. So it takes a gradual process for you to plan this transitioning. So let me ask you a question. So at what age should transitioning start? So let me tell you this. Transitioning should start at the age of 14 up to the age of 25 years old. By starting at the age of 14, it gives that child enough time to prepare them to when they get to an adult services. It gives them their independencies. It gives them their motivation. It gives them their confidence. It builds their confidence to get to that adult stage. So who are there to support? Because it's not only you alone. So by supporting this young person from the age of 14 up to the age of 25, if they've got that transitioning process smoothly, this will involve them to participate into activities. It will build their confidence. It will build their independence to even looking for higher education, even employment. They can even be in an employment as well if you build their confidence, if the transitioning go in a proper best way. So what are we saying here? Who will be the support? Because it's not only family alone. So bear me not. So it's not going to be only the family who's going to be doing all this support or transitioning. There are a team there that needs to start working with this young person since the age of 14. So I'll give you a step-by-step process how to get this support with this transitioning. The first person you can contact is the child GP. Talk with your child GP to make a referral to the community learning disability teams, because sometimes it's very hard as family to get in contact with the community learning disability team. They will always refer you back to speak to your GP. So the first point of contact is your GP. Inform your GP that your child is already at the age of 14 and they've got a special needs, which is a learning disabilities. So you want your child to be referred to the community learning disability team. So what does the community learning disability does? The community learning disability team, they are specialized in supporting people with learning disabilities, but from the age of 18 onwards. So it is very important to do the referral, because sometimes when you do a referral to the community learning disability teams, they will be on the waiting list, and sometimes it will take up to 2 years before that case can be picked up. So the earlier the better. When it gets to the 14, it's not gonna pick up immediately, but it's a gradual process to prepare the child to get to that stage. With the community learning disability team, what support do they do? When the child gets to the age of 18 years old, at the time, because like I said, it will take up to 2 years before they can pick up that case. So if the referral has been done in an earlier process, so by the time that young person gets to the age of 18, their case has already been picked up by the community team, so they won't miss out on any support from the children's services. Straight away they go to the adult services. Let me tell you something. When a child is in the children's services and that transitioning process doesn't happen and that child gets to the age of 18 and that's the time you said you want to do the referral, you will fail that child. You will fail them because the system will fail them. I've got tons of experience in this. Why I'm emphasizing this? Let me just give you a story of my experience. There was a time when this young person was admitted in a general hospital, and I was called to support this young person. This young person was 17 years old plus, almost getting to 18. And then they wanted to admit this young person to a children's services. And the children's services will not take this child. And the adult services will not take this child. So the child gets in the midst. There is no support there. What happened? I get in there. I went to the children's services and asked the reason why are they not accepting this young person. They said because he's already almost to 18, there is no services here, so he should be in the adult services. I went to the adult services, that is the wards area. They said no, he's not fully 18 yet, so they're not gonna accept the child. So it takes a lot of escalation, management teams, we all have to come there that this child needs to be treated. It doesn't matter, young or old, she needs to be treated. So that's where the gap was. When I asked the family, has it been referred to the adult services? They said no, they were waiting for the child to be exactly 18 before they can do the referral. And when it comes to young person, they stop working with that young person from the age of 17. They will be expecting that the adult services have already picked on. So they left that child. When they get to the age of 17, the children's services will start phasing out, leaving for the adult services to take on. So if that support is not there in that gap, that is where the system will fail that young person. So I have to fight for this child or for this young person to get the support he needs. At the end, they didn't admit him on the children's services, but I did succeeded for him to be admitted on the adult services. That is the adult inpatient. So in the adult inpatient, I have to organize for people to be there to support this young person. And I need to advocate for this young person so that his needs can be met. And at that same time, I was trying to running around to ensure that the referral to the adult community learning disability is done. I made a referral myself to refer this young person and then stress it out that this young person has been lost in the system. If they can prioritize his care because he's got a high special needs that he required. At the moment, young children's services, the children's services have already phased out. So this young person needs that support needs. He needs to have that good quality of life. He shouldn't be lost in the system. So I have to advocate for this young person. I have to call all the management in. I have to escalate this case before they picked up this young person case. So this is why it is very important to start that transitioning from the age of 14 gradually to prepare the family, to prepare the young person for them to get to that stage when it comes, so that when the change happens, there won't be any emotional or stress or anxieties there. They are prepared already since at the age of 14. So let's move on. That is just how it happens, why it is very important to do transitioning from the age of 14, prepare them to the age of 18. It gives them enough time, enough process of time for them to get there. So let's move on with the role of the community learning disability team. The community learning disability team will support these individuals. That is when they get to the age of 18. That is when they will start working with them by doing a full holistic assessment to identify what are the needs of this individual. When they are doing their first assessment, they look at all the health needs or the social needs that this individual require. Then they will place them down. So based on these needs that this young person has, that is when they will now go to their team and start discussing about the case. In the community learning disability team, there is a range of team there. It's not just nurses. You've got learning disability nurses, you've got psychologists, you've got physiotherapists, you got speech and language therapists, you got occupational health therapists, you got psychiatrists there, and then you've got support workers while working there. So there is a range of professionals working in the community learning disability team. So the first point of assessment is always the community learning disability nurse that goes and do the assessment. And based on all the information gathered and the needs of this young person, this is when now the community learning disability team will now identify who is the best team to work with this young person, including the nurse. If there is anything to do with activities engagement that this young person needs, occupational therapists will start working with this individual. If it's to do with mobility issues, then the physiotherapists will start working with this young person. If it's to do with communication needs, language, or eating and drinking issues, dysphasia, then that's when the speech and language therapists will then start working with this individual. If there is anything to do with medication needs, then that's when the psychiatrists or the consultants, that is their own role to support around medication and needs. So it takes a lot of process, a lot of professionals to work around these individuals to ensure that their needs are met, including the community learning disability nurse. They are there to look at the physical health needs. What needs is there that these individuals require. That's the role of the community learning disability nurse. They are there to point out what are the needs this young person has, who should be working with this young person. So they will bring them along to start working with this individual so that they can be they can be inclusive in the societies. So this is all called to support them to be included in the society. So this is very, very important to start transitioning at an earlier age. So I am advising you today as parents, family, carers, if you have your child who is still under the age of, even if it's 16, if they are around 14, 15, 16, get them be referred to the community learning disability team. This is the right timing for them to start transitioning. So it is very important to do that transitioning as earlier as better so that that child cannot be missed out. Thank you so much for watching, and please don't forget to share my video. Don't forget to like, don't forget to subscribe, and don't forget to comment. Help me to grow up my channel. I am educating and also I am advocating around people with learning disabilities, either young or old. I'm just advocating. Please share my videos and also subscribe so that we can grow up this channel. Remember, this channel is for all of us. And if you have any questions or any topic you want me to discuss, I'm always here. I'm happy to discuss that. Just put it on the comments below. If I picked it up, we can discuss it together. Thank you so much for watching. See you on my next video.